There will also be standards that will be written into the legislation in reference to dust control that we do not have at the present time. But we need to do more, and we're going to do more, and it'll be done, and the law will become effective.
In 1969, Congress created standards that would reduce coal dust in mines. Since then, tightening regulations, improved technology, and more mine safety research meant a steady decrease in the prevalence of black lung, at least for a while.
For some reason, around 1999, we just hit a brick wall, and we started noticing in the x-rays that were coming into our program massive disease. We were seeing disease in younger miners, some in their late 30s, early 40s. We were seeing miners progress from beginning stages of disease to the advanced stage of disease, which is called progressive massive fibrosis, at a very accelerated rate, much quicker than we'd ever seen before.
Wolf believes there are many factors contributing to the problem, but mining thinner seams of coal in harder-to-reach areas is the biggest problem.
And anytime you do that, you're going to cut through more rock. I call it junk rock. Cutting that rock is actually more hazardous to them than cutting the coal seam.
Dr. Edward Petzonk is a pulmonary disease physician at West Virginia University who co-authored the study of 138 coal miners with progressive massive fibrosis.
The major finding is that dust exposures in underground coal miners in West Virginia are causing severe and fatal black lung disease in large numbers of individuals, and the average age of the miners was only 52.6 years, which is pretty young to be either killed or disabled by your work.
There's limited treatment and no cure for the disease. Over the past decade, more than 10,000 miners have died from black lung. Since 1970, the federal government has paid out more than $44 billion in compensation for miners totally disabled by the disease.
The bottom line is, even all these different things, we can do better. And our coal miners that are providing this service to us deserve for us to do better.
The Mine Safety and Health Administration proposed new regulations last year that would reduce miners' exposure to dust using a range of strategies. The public comment period closes Monday. For West Virginia Public Broadcasting, I'm Glynis Board in Morgantown.